Niagara Falls Community Health Centre recently received a $200,000 capital grant from the provincial government's Ontario Trillium Foundation. Joining me in the studio to talk about this exciting news is Director of Operations, Laura Ciccone, and Family Support Worker, Nicole Soble. Laura, before we talk about the grant, can you please share what the Niagara Falls Community Health Centre does in providing health care?
Absolutely. So we are a multidisciplinary organization that offers primary care services to our community. But we also have additional services for not only our patients, but the community as well. So we have our allied health team, so mental health services through counseling. We have outreach supports. We have a kinesiologist, an occupational therapist, dietitian. So a lot of wraparound care, and I think that's the approach we take to healthcare is, yes, the medical portion is very important, but then we also like to kind of address those things that go along with that. So whether it's mental health or just navigating the complexity of the healthcare system or resource in the community. And then we have a whole host of programs that we offer. So they can be recreational programs, we have arts and crafts or exercise programs, and then some more focused educational workshops. We've done cooking programs, so just a lot of different services for both community members, but then our patient population as well.
Excellent. And Nicole, if you can tell me about your role as a family support worker.
Yeah, so my role as the family support worker is to support our new Care for Kids program. So families with children under the age of 5 and under, so when they hit 6, they age out of our program. So my role is to help them with system navigation, resource connection, forms completion, advocacy. We all know that navigating the health system right now is very challenging, and a lot of the folks that we served are barriered. And so helping families, parents figure out how to achieve goals and get what they need, that's my role.
Excellent. And Laura, how important was this grant in providing new services and renovations to your building?
Yeah, so we received the funding for just the actual Care for Kids program back in February. And so I think we slowly realized that space was getting a little tight of where we can provide all of these services without taking up more space from the rest of our team. So we realized that additional space was much needed. And when we applied for the grant, it was with the specific intention of catering to this program. So basically now with the funding that we're receiving, we have additional spaces for both our own staff as well as potential community partnerships that we can offer additional programming, additional services, one-on-one supports. So it makes it just a really great added space that it's catering to that pediatric population specific, where the equipment in there is specific to them. The furniture in there is nice and small for them as well.
It's safe.
Yeah, absolutely.
We found when we started transitioning into our regular space, like our plugs weren't in safe spaces, our toilets weren't small enough, our sinks were too high. And so just transitioning to make it a space that's more appropriate for the pediatric age range that we're serving to is much needed.
And did I see right, it's an actual dinosaur bed for the children?
Yes, yeah. Our clinical space has an exam table that has a dinosaur bed, and we have a couple other friends around the clinic as well that kids can check out, just trying really hard to make it a warm, welcoming, fun space. Mm-hmm. Yeah.
That's awesome. And Nicole, can you touch on some of the programs that have already started or coming up?
Yeah, absolutely. We have quite a few things that we've offered. Our programming will change quarterly as we meet the needs of the community and respond to attendance. But something we tried this year is Babes and Beats, which is a baby wearing program where mothers can wear their babies, whether in carriers or slings, and then participate in exercise where it's drumming on exercise balls. Nice. super fun. We've done some English classes for parents, newcomer parents and their children, like circle time in English, some arts and crafts programming, intro to solids, where we're teaching parents how to approach feeding your kids solid foods for the first time at 6 months of age.
Excellent. And how has the community embraced these new changes?
I think they're enjoying having additional services. So we typically didn't have a lot of programming opportunities for young children and families. So with the Care for Kids program, we've been able to kind of cater to that population, and we've seen such a significant increase in families coming to the community health center that it was such a nice fit for us as well. So they're responding well, but I think the big need that it's also addressing is kind of that the gap in medical care access for children 0 to 5 specifically, and I think that's where this all came into play, is that from a ministry level they identified there was a gap in where care was needed, and that 0 to 5 range, there was a lot of, whether it was hospital admissions or just walk-in clinics were getting inundated with babies and children that were sick because they didn't have a primary care provider that they could go to. So our program addresses unattached children. So if you don't have a provider, whether it's a nurse practitioner or a physician, that's who we cater to. We look to help with routine immunizations, well baby assessments, and then any type of episodic care. So we hope to alleviate some of that pressure from the hospital system when people are showing up there because their children are ill and they have nowhere else to go. But again, giving everyone an opportunity for good access to health care.
And finally, how can our viewers find out more information about the center?
Yeah, so we have our website. So our website is www.nfchc.ca. So we have a lot of information, one about our regular clinic, but there's a Care for Kids page as well. And so you can find all the information about how to make an appointment, how to join one of our programs, and just kind of an overview of the types of things that we offer.
Excellent. Nicole, Laura, thanks so much for joining us, and maybe come back in the new year and tell us about some more great things going on at the center.
We'd be happy to. Thanks so much for having us.
Thank you.